Hi, everyone. I guess I'm the live example of a crisis in a vaccination program, and also how to gain the trust, and maybe looking forward and how we can make our program more resilient in the future based on some of the experiences that we had with our HPV crisis. So now I'm calling it a crisis. It took us a while, because usually we do have a very robust vaccination program, and we really dislike the crisis part. So, but now coming on to the other side, it's more fair to say so. Okay. Okay, just to put a frame on the Danish childhood vaccination program, maybe coming back to the previous speaker. Our program is, the utility of the program is very easy. We have a free of charge vaccination program. It's generated through the general practitioner's office, and usually we do have a very high vaccination coverage through our childhood vaccines. And we actually also have a very high degree of trust in, and I think that was also what Heidi Larson and her group could measure when she came to our country. But usually a high degree of trust in our recommendation coming from the authority and from the government. And that means that usually our vaccination uptake is above 90% for most of the vaccines, and also above around 95% for most vaccines in the childhood vaccination program. For the HPV vaccine, it was one of our late introductions in 2009, and that was for a girls-only program, and we just introduced it for boys as of 1st of September this year. And initially it went very well, mirroring the rest of the vaccines in the program, with an uptake around 90% for the first dose for the girls. But then came along a lot of media attention, a lot of comments on adverse events, suspected adverse events among girls who had medically unexplained symptoms. And they expected them to be from the HPV vaccine. And since we had this very high coverage, and we even had a catch-up program for girls to the age 26, which also had a very high uptake, actually almost everyone was vaccinated. So linking this medically unexplained symptoms to the vaccine was kind of the easy route. And what happened in the media landscape was that the big broadcasting networks took on this story. And what you see on the pictures down on your left corner is a lot of ladies or girls who came forward with their medically unexplained symptoms, and it was made a documentary of these girls or ladies, and they were actually very personalized stories and very moving stories. And after this was broadcasted, it like kind of perpetuated. So on all the social networks and everywhere, we just experienced that people now were using the search engines such as Google to Google adverse events on the HPV vaccine, and not just the HPV vaccine or anything to do with why we vaccinated in the first place. And what happened, this is a curve showing the Danish vaccination uptake. On the x-axis you have the birth cohorts, so you have to plus that with 12, because we give it at 12 years of age. And then we have the different lines is our Nordic countries, which shows you that Denmark is the only Nordic country that actually sees this downward trend, this rapid downward trend in vaccination uptake, and it's not really affecting our neighboring countries. I know from my neighbor colleagues who are also here in the room, of course, they were really scared that this was going to rub off on them, and of course they took their measurements, and as you can see, they succeeded. At least it didn't rub off. Unfortunately, we did export it to our Irish colleagues, who also got the same documentary. It was reinvented in Ireland with Irish cases, and they had kind of the same situation, and we have had a very close collaboration with our Irish colleagues during this period. But what was very important for us was actually to take a step back and saying we actually do feel that we actually do have a somehow robust program, but even though this happened to us. And it was very clear to us that what we usually do was actually not working this time. So to come back to the communication part, we needed to learn something from this. So even though the first move, you actually felt like being in my position was like running out and doing a lot of things, and especially doing more of what you usually do, this was not what we decided to do. We actually decided to take kind of a scientific approach to this and actually do to inform ourselves on what would be our next move. What was actually, what was our, the citizens, what did they actually want from us at this point of time? And actually, I don't think, like we talked about, you tend to think that, I think it was the Philippine colleagues who just say you tend to like want to throw a lot of information in their head, but that was actually what we had already done, and it wasn't effective. So what we did was actually first to make a media analysis to actually see what was going on out there, what was the talk about, what was the talk on social media, on the big broadcasting media, what were they talking about? And then we made focus groups, interviews with mothers and parents to see what was actually their knowledge and perception and attitude about the vaccine at this point of time. And what we experienced was that 1/3 of the mothers was in doubt of whether to use this vaccine now, and they were waiting. They were hesitant, but they were not really anti the HPV vaccine. They were just very confused and very scared. And then we made an online survey of parents just to reach more and to be able to qualify our knowledge in the field. And then asking them a lot of questions on if you wanted to change your mind at this point of time, what would you need from us? What would be the messages that actually would work in order to make you reconsider? And that was what we used the phase 4 to actually go out and test these messages in our focus groups and say, if we told you this, would it then make you change your mind, or would you prefer one or the other messages? And that actually gave us a bouquet of messages that then made the core of our campaign. And what was very interesting was that the parents kept telling us, "But you know what we need? We just need more information. You just have to give me that one study that shows me that I have nothing to worry about." And everyone who's been in science for decades and decades like me knows that it's never going to happen. And then they say, "You don't have to tell us something emotionally. I will be persuaded by the cognitive knowledge." And that was so different to what you could see and what was happening in the media landscape, and also what our WHO colleagues and Cornelia Betsch, who's also leading one of the sessions this afternoon, what some of their studies saying that actually if you already emotionally made a choice, you cannot by knowledge make them change their mind. So we were very aware of that we also need to bring in some emotion into our campaign. So we started our campaign, it was launched in May 2017. And one of the main messages we got from the parents was that you need to collaborate on this. All the authority needs to collaborate with all trusted partners in the Danish landscape. You need to use all the ones that we trust, and they need to stand behind you. So that was what we did. We went out and we made this campaign in partnership with our Danish Cancer Society and the Danish Medical Association. So on all the messaging that came out was with all these 3 partners behind. And then on top of that, we also made a network of a lot of other partners who were also boosting our messaging all the way. And then the elements of the campaign, it was a lot of elements, but of course, one of the things the parents said as well was that we need one page, one landing page to go into. We cannot shop around, so we need to know that there's one landing page, and that's where everything is in. And also they told us that you need to put in, whenever you have any kind of numbers, anything, you need to have a reference to that. And usually, if coming from the authority, we chew everything and we make it very easily read for the population. And they said, no, but if you go to the anti-vaxxers, they always have that one study that shows you that's why you shouldn't vaccinate. So you need to convince me that science is also behind your decisions. So we said, okay, we don't expect you to read it, but that's what we'll do. And then we made a Facebook page, and that's like the new baby for us, because that's not where we usually used to communicating, but that's what we did. So we made a web page for the campaign, and actually they got an answer 24/7, and there's nothing about excluding anyone, not even with radical views. Everyone get a nice answer, and everyone gets a personal answer in there. So we would use our names, saying sincerely Bolette, answering you now. So it was in a very personal voice. And of course, it was a huge amount of work, but it's been very successful. And of course, then we had some more physical material for the healthcare workers. We also did workshops built on the work from the WHO group on how to communicate with vaccine hesitant parents. So we made that around the country. And then we also made a lot of work with the press, talking about how to communicate on science and the science pyramid, and talking about meta-analysis, randomized controlled trials is totally different to talking about case series, and you cannot put them, head to head. So we worked a lot on that too. And that's some of our other network colleagues who also treat and use all our material. So if we focus on what we did on Facebook, because I know that's some of the new things that what we've done all the way through our Facebook communication, we make new material for our Facebook page, usually in the beginning once a week, now maybe every fortnight or something. And what we do is that we communicate both to heart and brain. And that was a bit new for us, the heart communication. We were very scared whether the anti-vax and the community would really take that on. But what we have done is use the personal stories, and the lady on your left is one of the ladies who actually, we did this stepwise. So in the beginning, we put stories on women who've had, young women who've had only precancerous lesions, but this lady is actually terminally ill from cancer, from cervical cancer, and that she's sharing her story. And I know our colleagues from Ireland is the same, and you probably, a lot of you have heard about Laura Brennan, who is their doing a lot, their champion in this field. We didn't have one champion, but we had a lot of these personal stories, and they were definitely the one who was the most engaging for the audience on our Facebook. And then, of course, we did put all the science, and we did a lot of things. We also did a lot of fun stuff in there, and a lot of engaging, and we measured whatever we did in there. So we measured what's the comment rate, was that positive, negative, neutral, and we're going to make a publication on that. So how you can monitor that. And then we work with the press and bringing out the positive stories, bringing back the focus on why we vaccinate, why would you put this into the program, because we want to prevent cancer. This is a vaccine against cancer. It's a fantastic achievement, and we put that into the scope, not only talking about the adverse events, but talking again about why do we want to vaccinate. And that was really effectful. They said, the ones who measured the media landscape said, you went from going from a horrible landscape where everything was negative. They hadn't seen anything like it since something, whitewashing of the huge banks in Denmark, and then going to a very positive landscape within 1 year. So that was quite amazing. And then, of course, we did other things. So we also used champions outside in the community, and this is a sports team showing our messaging on their shirts, and then we had the Danish Cancer Society, and that's one of the beauties working together. They have a lot of volunteers, over 40,000 volunteers in the country, and one of their the things that they have to work on this year and the coming year is bringing forward the HPV vaccine. So you can use this enormous amount of volunteers who goes out in every corner of the country and talk about why we should vaccinate, and they have all our pamphlets and everything with them. And of course we support them, and we have made a team of young doctors who can go out and support them on their different activities. So, and then the last part, what was very crucial to us, and not maybe on demand from our side, but actually turned out to be a very positive experience, was actually talking to the very vocal parents. The parents who were performed by the parents to the girls who had these suspected adverse events, and they were very critical, to say the least. And we had a meeting with them every month, and we were in the beginning very distant from each other, but actually moving forward, more and more time was spent on talking about what we could do for the girls, and not so much about why she came to be in this position and whether this was the vaccine or not, because we could never agree on that. But we could actually agree on, and of course we would like to help and bring some good into her process in the future. So actually, I know this is from literature, not usually what what you would recommend, but actually for us it was a very positive experience, although it was tough work. So where are we now? This is the curve showing the numbers of persons getting HPV vaccinated by calendar year. And as you can see now, moving into 2018 and the same in 2019, actually now more persons are being vaccinated than before the crisis. And of course, that's because we have a catch-up of a lot of the girls who waited. And what we see now is that some of the birth cohort who was very low, down to 25%, is now turning a corner around 80% vaccination coverage. So that we are very proud of. Yeah, thank you.
We had a lot of heated discussions about what the implications of these photographs are, and certainly there were many photographs that could have occupied this space.
A lot of the images are presenting to us hugely important aspects of health and medicine around the world. What really works is a story either about the state of humankind, the state of our planet, the wonders hidden underneath our skin.
Looking through these incredible bodies of work, there's something that will move you emotionally, but also have a visual language which is complex and refined and sophisticated.
So I look at what's the power of the image, and then what's the story? What is it trying to tell us? And does it want me to come back and look again?
I think that we've seen, both in technique and subject selection, innovative approaches that break from tradition in exciting ways.